So stroke is a temporary acute loss of blood flow to the brain. And there are two main types of stroke. There's bleeding stroke, when a blood vessel in the brain ruptures and causes pressure and a hematoma in that area of the brain. A much more common type of stroke that we deal with is called ischemic stroke, and that's when a blood vessel that supplies blood and oxygen to the brain gets closed off. And that blood vessel can either close off itself, or a clot can come from somewhere else and get stuck in the blood vessel, causing what's called an ischemic stroke, or part of the brain that doesn't get enough oxygen or blood. Symptoms of stroke really depend on where in the brain the stroke occurs. The hallmark of stroke is usually what we call laterality. So it's symptoms on one side of the body that aren't present on the other side of the body. Sometimes strokes don't have that, but 90% of strokes do. So it's weakness on one side of the face, weakness in an arm or a leg, numbness on one side of the body. The acronym FAST, F-A-S-T, is often used for stroke recognition. It's face, is there drooping of the face. The A in FAST is arm, so you have somebody raise up their arm, and can they do that raise and hold it up if it doesn't fall. The S is speech, are they slurring their speech, or are they having trouble with words? And then T is time to call 911 if any of those things are present. So acute stroke is an acute neurologic emergency, and the quicker you get treatment, the better. So the main treatment that's been around since 1996 is a medicine called IV-TPA, or tissue plasminogen activator. That's an IV medicine that works by dissolving blood clots and opening up blood vessels. That can be given safely in the first 4.5 hours after symptom onset. And that's why it's so important to get into an emergency room or a medical facility where they can potentially administer that medication as early as possible. The other treatment for acute stroke that's really just come about in the last probably 5 to 7 years is mechanical intervention. And that's when they go in through the groin and they go up with a small catheter using a retraction device and try to pull the clots out of large vessels. So when I talk to people about either primary stroke prevention or secondary stroke prevention, there's 4 main risk factors that I talk about. So diabetes, high blood pressure, cholesterol, and smoking. Those are the big 4. There's lots of other sort of less important risk factors for stroke, but those are the big 4. So diabetes, have you been checked for diabetes? Are your sugars under control if you are a diabetic? That's a long-term battle, much like high blood pressure. And that's something that both of those things you can work with your primary care doc, trying to lower your risk with those. Cholesterol is an easy thing to check. Some of it's diet, but a lot of it's genetic. So if you have high cholesterol, even with a good diet, you may still need medications to help control your cholesterol. And then the last one is smoking. And that's something that is a lifestyle change that we try to convince people who are smokers to give that up. And that's probably the single best thing you can do for your long-term health. So there's been a lot of press in the last couple years about whether people should be taking aspirin or not. And a lot of people have come off aspirin because there's been a couple of studies that have shown that aspirin can actually increase your bleeding risk. For people who have never had a stroke or a heart attack, or don't have a strong family history of stroke or heart attack, probably don't need to take aspirin on a daily basis. But if you've ever had a stroke or ever had a heart attack, or ever had your doctor tell you you needed to take aspirin every day, or have a strong family history of any of those conditions, it's really critical that you continue to take aspirin, even though you might hear in the lay press that it's not safe to take. So it's something to talk to your primary care doctor about. So this is the easiest question to answer of all of them, but often is the one that's missed by most people. So if you think that you or somebody you care about or somebody you see is having a stroke, the single thing you need to know is to call 911 as quickly as you can. Stroke treatments work best if they get on board early. And we talk about the 4.5 hour window to give TPA. We know that every 15 minutes that you delay, there's a demonstrable change in outcome for for that delay. So the sooner you can get people into seeking medical care in an emergency room where they can potentially deliver those medications, the better. So go through your FAST acronym: face, arm, speech, time to call 911, get that patient into the emergency room as quick as possible. And really, any emergency room is typically capable of giving TPA, even in the smallest of rural communities. So call 911.